Welcome to our next installment of Doc Talk. I'm Dr. Rich Briones, Chief Medical Officer at Good Samaritan Hospital. And today I have the distinct pleasure of having with me Dr. Fahd Khan, a member of our medical staff for a few years. He and I shared the operating room, I as an anesthesiologist, he as a neurosurgeon, for many a case, and I'm delighted to have him here with us today to talk a little bit about who he is and what he does.
Great. Thanks for having me, Dr. Briones. It's great to be with you here today.
Wonderful. Well, Dr. Khan, you've been here, the time that you have, a long time. You and I, in particular, worked on a case many years ago with a patient that had a movement disorder. And I know that's what really is your expertise. So tell us a little bit about your practice.
Sure. So that's not only my expertise, I would say it's also my passion. So I'm a functional and stereotactic trained neurosurgeon. So that means I did an extra year and fellowship around this. I did this down the street at Stanford. And that's my particular interest in terms of my clinical practice. It makes up a significant part of my practice. And the case that we did together was the first deep brain stimulation surgery performed here at Good Samaritan Hospital asleep. So that was back in 2014.
Yeah, no, that was a few years ago. And I know that patient has since gone back to visit you. I've seen some very striking video about that. And I know that can be and has been very life-changing, for that patient and certainly all the patients that you treat. We are also very excited that we have a new technology that is going to be coming to us at Good Sam that is going to help patients like that patient in a very, very significant way. So maybe you could share a little bit about what that new technology is.
Yes, so this technology has been in the process of research and development for quite a few years. It was approved in 2016 with its initial programs scattered throughout the country. But we are lucky and fortunate enough to be able to get this procedure very soon, hopefully in the next couple of months. It is essentially incisionless brain surgery. So what that means is there's no opening of the scalp, no hole into the skull, and what it uses is ultrasound waves to penetrate into the skull and heat up a particular part of the brain that's essential for controlling different types of tremor.
This is wonderful. This is truly Star Trek-like procedures where an individual can come in, and it doesn't take very long from what I understand.
That's right. So it's an outpatient procedure, and the results are instantaneous. So usually the patient would come in, the scan is done in the MRI scan, and the procedure is performed in the MRI scan. So it's not necessarily in the operating room. Patients do not require any anesthesia. They come into the suite, and they're fitted with a helmet, and through that helmet, they're fitted with a transducer of ultrasounds. And those transducers of ultrasounds are able to focus on a particular part of the brain. We're talking about millimeter accuracy. And what that does is all those transducers focus on that particular part. They heat up that particular part of the brain, and then the surgeon comes in and out of the MRI suite to see what their responses are. And based on their responses, that area is heated up even more and creates a small little burn in the brain. And voila, the patient's tremors dramatically improved.
And these things are striking. These effects are striking because as some of us know that have relatives that have these type of things in their lives, they can be very, very debilitating. So to be able to come in and essentially not be able to lift a cup of water up to their lips, because they're shaking as much as they are, to within an hour be completely transformed. From the videos that I've seen and I think you've witnessed, the emotions that take over both from the patient and their families is truly amazing.
Absolutely. So the indication that we're talking about for this is something called essential tremor. So essential tremor probably affects 5 to 7% of the population. And when you look at that number, it can be up as high as 10 to 15 million people in the US. Essential tremor is the most common movement disorder. And when we talk about movement disorders, we talk about essential tremor, Tourette's, Parkinson's disease. And essential tremor is about 20 times more common than Parkinson's. So when people oftentimes think about tremor, they think of Parkinson's, but actually essential tremor is much, much more common. When we look at sort of the numbers and how it happens, about 70% of essential tremor cases are familial, meaning they have a genetic predisposition. So when a patient comes into my office, one of the first questions I ask them is, who else in your family has a tremor? Parents, grandparents, aunts, uncles, siblings, and oftentimes a lot of them do. The tricky part, though, about essential tremor as opposed to Parkinson's, in Parkinson's, we have very effective medications. In essential tremor, not so much. We use typical medications that are used for slowing the heart down, medications that we use for seizures, but there's no particular medication designed or made for this specific indication. As a result, patients don't have really good results with the medications. They may try it for a while, maybe it works temporarily, but at the end of the day, it doesn't really resolve all their symptoms. And we also know that this is a progressive disease. So if they start off with tremors in their 20s or 30s, we know by their 40s or 50s, the tremors are a lot worse. And a lot of it also has a social stigma to it. People become very anxious when they're in public, when they're trying to eat, or when they're trying to drink, use a spoon. They become really anxious about it. Also, it affects people's livelihood. You look at the numbers, about 25% of people with essential tremor oftentimes need to either switch their job or retire early because of their tremor. So it really has a total impact on patients and their livelihood. And it affects their family members too, because patients may be less reluctant to go to a restaurant, for example, less reluctant to get out of the house, and it has an effect on their mood too. So we do see higher rates of depression in people who do have essential tremor.
Very interesting. And this really dovetails into the part of the episode where we always like to go to busting a myth. So one of the things that we talk about is, that would pertain to this is, oh my gosh, if I have a family member that is displaying a tremor, does that mean that they have or are going to have Parkinson's? Because Parkinson's is a very scary thing, as you point out. Is that the case?
Not necessarily. I think in that case, what they need to do is see an expert, either a neurologist or specifically a movement disorder neurologist. So movement disorder neurologists are the doctor who specialize in tremor. If you can see them, that'd be ideal. And there could be multiple causes of tremor. We talked about a little bit about essential tremor, which is a strong family history. Parkinson's disease. People often think of Parkinson's disease as just having a tremor, but Parkinson's disease is also associated with a lot of other different symptoms too. Gait imbalance, rigidity. So we really need an expert to sort of tease out what the problem is. And sometimes tremor could be medication related. So maybe they start a new medication. Maybe they have to change that medication or reduce the dose to see if that may be the cause as well.
Wonderful. Well, want to really thank you. I think our patients, our medical staff, our community are very fortunate to have someone here, locally that has expertise that you have, coupled with the technology that's forthcoming, what we're going to be able to offer to our patients, and certainly, continue your passion, in the space is outstanding. So I want to thank you for your time to visit with us today.
Great, thanks. And I'm really looking forward to partnering with Good Samaritan Hospital. I really think this is an asset to the community and will continue to bring the cutting edge care that people deserve here.
Wonderful. Great. Thanks, everyone.